So my name is Greg Jungles. I'm the Health Tech Startup Catalyst at Georgia Institute of Technology's Advanced Technology Development Center, ATDC. ATDC was founded in 1980 and is one of the oldest technology incubators in the country. We have successfully graduated over 200 companies that have gone through our program, and we currently have over 150 active startup companies in our portfolio. Today's conversation is intended to explore recent and emerging health technologies that will enable current and future members of senior population to age in place, while receiving quality, cost-effective care outside the traditional clinical setting. First, and very briefly, some statistics to set the stage. The Population Reference Bureau projects that the number of Americans aged 65 and older will more than double from 46 million in 2016 to more than 98 million in 2060, resulting in the 65 and older age group making up almost 24% of the total population. According to the AARP, nearly 90% of adults over 65 want to remain in their current homes as they grow older. The AARP reports that the number of seniors requiring additional care thanks to chronic illness will increase from 14% of the senior population in 2010 to 21% in 2050. Mercer estimates that by 2025, U.S. providers will face collective shortages of about 500,000 home health aides, 100,000 nursing assistants, and 29,000 nurse practitioners. These are trends that are driving the transformation of care delivery model to support significantly growing senior population that's motivated to age in place. Technology development and adoption will be the key drivers for enabling seniors to achieve that goal. With the stage set, I'm very excited to introduce our panel for today's discussion. Jamie Clark is the co-founder of Catalyst by Wellstar and serves as the Director, Innovation and Venture Strategy for Wellstar Health System. In her role, she leads the day-to-day operations of leading health system innovation company charged with designing the future of healthcare and driving growth through emerging business opportunities. She is also active in the Atlanta venture community and serves on the selection committee for Engage, an innovation platform that is venture funded, comprised of partnership of category-leading corporations. She previously served as progressive consumer and innovation roles at Novant Health in digital health and engagement. Dr. Tracy Mitzner is a senior research scientist at the Center for Inclusive Design and Innovation at Georgia Institute of Technology. Dr. Mitzner received a doctorate in cognitive psychology from the University of Kansas, and her research focuses on understanding age-related changes and potential technology in support of older adults, including those with disabilities. Her research topics include older adults' acceptance and usage of emerging technologies, particularly for application to facilitate social and physical wellness. Dr. Mitzner is co-director of TexAge, an NIDILIR-funded rehabilitation engineering research center focused on technology to support aging in place for people with long-term disabilities, and senior research scientist at the Center for Inclusive Design and Innovation at Georgia Institute of Technology. Joseph Eberwein is co-founder and chief financial officer of Corstrata, a technology-enabled care management solution focused on improving health outcomes for wound and ostomy patients. He has spent the majority of his career in post-acute home health and hospice industry with extensive executive management experience running multiple lines of business. Our moderator for today is Dana Weeks. Dana is the chief executive officer and co-founder at MedTransGo, a healthcare technology startup based right here in Atlanta. Dana has led several entrepreneur ventures and held corporate positions in the Southeast and beyond. Dana received her BA from Stanford University and an MBA from Columbia Business School. Dana is active in a variety of boards and councils, including as co-chair of the Stanford Lead Council, a board director of Blue Owl Capital, and advisory board member of Stride. Win Your Way, and founding member of Columbia Business School Women's Circle. In Atlanta, she is a trustee of Westminster Schools, where she serves as chair of the Diversity, Equity, and Inclusion Committee. Welcome to each of you, and thank you for being here today. With that, I'll turn it over to Dana to start the discussion.
Great. Thank you so much, Greg, and it's great to be here. Nice to see all of you, and thank you for coming. Excited about this engaging conversation, and I'm really excited to hear more from the fellow panelists in this conversation. So, given that the topic is aging in place and how technology is transforming the care delivery model, I thought that we would start just even level setting and figuring out, the definition really in our eyes of what aging in place is. And so I would just ask some of my other panelists, for example, what they think aging in place is. And I'll start maybe with Tracy.
Thank you. So really what I've learned about what aging in place means is that, first of all, it might mean different things to different people. So the most important part of aging in place is that people age where they want to age and when they want to live where they want to live, when they want to live there. So I think the research has shown that most people do want to age in their own homes, but there are some people who move to retirement communities or other types of places, and it is important to not discount that. But the other part of aging in place that is so important, and it goes beyond the place, is people want to age in their communities with their friends, maybe family nearby, and with their care network, wherever that is. So again, it varies from person to person, but and I think that that's the most important part of it, is to understand that it's personalized.
Great. Joe, do you have anything to add?
No, I think Tracy covered it well. I think it would just be a matter of really kind of delving into that person's choice, as well as what support systems are in place to enable that and facilitate that choice of living where they want to live.
Sure, I'll add. So WellStar serves 1 in 6 Georgians. We take care of patients from birth to end of life. And what that means is building those preventative care models that enables people to age and receive care wherever they are, at whatever age they're at. So I think first and foremost, care, aging in place is not just between a patient and provider. To Tracy's point, it takes a community. It takes other services besides actually delivering care, and that is a great level set to this great conversation that we're going to have today.
Yeah, I definitely agree with all of the things that you've said, and I really feel, given our experience with MedTrans Go and the people we actually, who are our customers and the ultimate patients, that I've expanded my idea of what aging in place has been. So in some senses, I really thought it through as a voluntary thing for folks to want to be able to age in place. But really what we've seen, and in rural communities and just culturally, that oftentimes it's not a voluntary issue, and that there are things that you need to age in place just by nature of not having those access to resources. So that's an exciting part. I don't know, Greg, do you want to add anything to that?
I think you pretty well covered it. I don't have my
Great.
Yeah, I think you pretty well covered it.
Perfect. So I think as a transition to that, just looking at what we do, and we're representing a number of different areas here, what type of work does your organization or community, company do to address the rapid growth that Greg referenced in his intro about the aging population? Joe?
Sure. So, we at Corstrata work with kind of a niche population of wound and ostomy patients, but that cohort is about 15% of all Medicare patients are dealing with a wound. And you've got a whole lot of complications related to diabetes. And as we know, the CDC says there are about 96 million pre-diabetics, many who do not even know that they have the condition, about 36 million diabetics. There are major complications relating to wounds based on based on diabetes, like diabetic foot ulcers. 1 out of 4 individuals with diabetes will get a DFU, a diabetic foot ulcer, in their lifetime. 1 in 4 of those will have an amputation at a cost to the system of about $100,000. So we're bringing technology to bear, but we're connecting that technology with scarce resources, which are board-certified wound and ostomy nurses to drive outcomes.
Great. You know, I think we do a similar thing with MedTrans Go in having addressing just basically the larger numbers of people who need access to transportation and interpretation. We're just seeing that what we had predicted is really what we're seeing in terms of the need, and continuously growing with that. But, you know, kind of moving on into the technology part of it, I'm wondering, you know, what kind of technologies are starting to be deployed to improve this care and the ability to age in place. And I might start with Tracy on this just to see about your thoughts on that.
Well, definitely in terms of the work that's being done at Georgia Tech and specifically with our center, we have done work in robotics, and I think that robotics is going to be a huge area. And one thing that we really have tried to focus on in our work is how can robotics, for instance, support home health providers, not take over their jobs, but we've done research asking the providers, how would you want support? And really they want things like robotics to support with the really physically demanding cleaning, certain types of tasks so that they can focus on the actual care tasks and even just communicating and spending time with the care recipient. We also have a smart, a smart home at Georgia Tech that's embedded with sensors and other technologies that can be used to develop new technologies. And one of my colleagues is developing a smart bathroom. Imagine a bathroom that when you walk in, it knows kind of what your capabilities are in that moment, and the hand grabs and everything adjusts for you, you know, for that time and space. And I'm working on a tele-Tai Chi intervention. So again, kind of building on the last session, telehealth. A lot of my work focused on tele-wellness. So how come it's, you know, more of a preventative? How can things like video chat help people maintain their physical and social wellness? Just some examples.
No, great. And you know, it's with us, the two of us being entrepreneurs and sort of by nature being in innovation, it's really exciting to see larger institutions like Wellstar engage in this innovative space. And so I might ask Jamie, just, you know, from their perspective, like what technologies are you seeing in terms of being deployed for this improvement of care?
Sure, absolutely. And really, when we launched Catalyst last year, the whole point of it was to learn from other industries and these changing consumer demands, expectations of what's happening out there in retail, e-commerce. You know, for example, Amazon's recent acquisition of the vacuum robot and how that can contribute to healthcare, and now we could monitor and improve outcomes of patients aging in their homes. And so Wellstar, I believe, took care of over 4,000 patients this year so far in their home. And we have a variety of digital capabilities, but of course, healthcare has a long way to go to continue building on this foundations and enabling and empowering our team members with tools. You know, at the end of the day, taking care of patients requires empathy and human contact, and technology is really just a tool to get us there and to enable, as Tracy mentioned, that care to be delivered in empathetic ways.
Nice. So, you know, transportation, where we sit, is the third most commonly cited barrier to accessing health services for older adults, and over 40% of seniors report being regularly restricted because they do not drive. And statistics like this are showing us that issues of access need to be solved with technology and technology solutions. And then there are just really some must-haves in terms of aging in place. In some senses, what the technology does for us and for our clients and customers is help us be more efficient or help the healthcare system be more efficient. And I'm wondering to others on the panel, what other technology kind of must-haves should we have for aging in place? And this is to anybody.
Sure. What we see a lot, and because we're 100% virtual, we are, using technology to create access to very scarce resources. What we see often as a barrier and really a must-have is more access to broadband, more access to internet capabilities, and then also a lot of the populations do not have smart devices, and obviously those are critical to be able to connect with this kind of care. So we're seeing different legislation, different, monies earmarked for this, for rural communities or for populations that may not have access to that digital capability. So that's one area that we see.
Yeah, I mean, I'll just add, we can't just deploy technology and expect people to use it and know what it's like. We need to teach people and enable them and make sure that those experiences are designed for them, and access to broadband and internet and cell phones and tablets. All of that should be part of the work that we're doing. It's a community effort. Health systems, we have to partner with these telecommunications companies and all of the other community members that are going into driving these health inequities.
Yeah, I love that you said it's a partnership and collaboration, and I think even just in our coming together in conversations, we really have seen how both it's evolved in terms of bringing people together, but how important and essential it is to make sure that each of the parts and pieces are together. So kind of changing a little bit, but, wondering what your thoughts are, and I'll start with Tracy on, what's the most common misperception about aging and technology?
Well, I think the most common misperception is that older adults are afraid or can't use technology. And really, and I'm sure everyone up here has had personal experience with the opposite of that. But also, we've done research on technology attitudes, and some of our largish scale findings are that really older adults, they're interested in technology, they want to use technology. We know that two of the biggest predictors of technology adoption are ease of use, which I think people are pretty aware of, that it needs to be usable. But the other predictor is perceived usefulness. So we really need to understand what the older adult needs support for and what their preferences are for that support, because if there's a mismatch there, they're also not going to accept it. And so that really, so much of my research focuses on ease of use and perceived usefulness.
So, piggyback on that, what are some of the other biggest challenges in developing technology for aging in place? And I would, Joe, I don't know if you have a comment or a thought on that.
Yeah, I think, if I could, I'd like to add one
Oh,
thing
yes,
that Tracy.
please, yeah.
Yeah, I just have a great kind of anecdotal story about that adoption of technology in the elderly or older population. We had a customer call our intake center. It was a lady, a 96-year-old lady who had an ostomy, and she had had it for 40 years. She had had no issues previously, but all of a sudden she was having issues, and she was literally, prior to this, doing yoga on the beach in California at 96, and that was very important to her. And so we had a telehealth visit with one of our ostomy nurses, identified the issue, got it corrected, and she was back on the beach doing yoga. So 96-year-old was able to do a telehealth visit very easily and really restore her to that quality of life. So wanted to add that.
No, I'm so glad that you did.
Yeah. And as far as some of the barriers, one of the things that we are constantly challenged with as an early stage company is really demonstrating what are the outcomes. You know, how does this tech-enabled service improve our outcomes for our members, for our partners, for anybody in that ecosystem, not only obviously financially, but also what are the clinical outcomes. So that often is kind of a barrier if you're not able to demonstrate those. I would say another one is really kind of, and this kind of goes along with clinical burnout, which we all know, staffing issues, et cetera, but really kind of digital app burnout as well. There are about 350,000 digital apps currently available in the app stores. Imagine, you know, either a clinician or a patient caregiver trying to maneuver that system. So we see that as a barrier as well, but also an opportunity for education.
Trace, do you have anything to add?
Well, I just want to add to that. I think this idea of really curating for people what their options are. In one of our studies, we have this, we call it a digital assistants in a box. It's an Amazon Alexa. We're doing a field trial, sending that to people who live in the community, and we're giving them a curated list of the skills that can be used, and we develop those based on interviews with older adults and what supports they might want. So it's hard to know when you have a Alexa what all is in there, but when you're kind of guided and given some curation in terms of what might support you, I think that that's very helpful.
Yeah.
Yeah, I'll add, you know, one of the broad barriers is we just assume patients won't like it. And I think we can all remember, you know, when Apple took the button off the iPhone and how frustrated we were. And for example, you know, we just need to get this technology in front of people and teach them and show them that it is and can improve their outcomes. We did a virtual reality pilot with our org learning team, and just getting people in headsets and showing them that they can be comfortable in those environments and that it can actually improve their learning. And then they said, oh, okay, you know, I feared virtual reality before, but now I feel comfortable and I see how it's beneficial.
Yeah, definitely. Greg?
Yeah, just to add real quick, I think that there is so much digital noise in regard to apps or platforms that are not holistically put together or integrated. And it's a barrier to adoption of technology as well. So it's so refreshing to see enterprise organizations developing their own strategy, but seeking out new technologies to develop an integrated, cohesive solution that will help and consider the adoption by all the users of that platform.
Right. I mean, and then just kind of as a follow-up to that, you know, what are we seeing also in terms of regulation and state and federal policy that affect kind of aging in place or make the transition either harder or easier to adopt this technology?
Sure, yeah. So one of the things that is, from a policy standpoint and a regulation standpoint, really is the state telehealth laws. And that is often a barrier to access of care. For instance, the nursing has a national licensing compact act, which I think is up to about 34 states. There's still 16 that are either currently grappling with it or don't have it on their roadmap at all. COVID really made it very clear that access to care was critical. I mean, I'll just give you one stat. The number of diabetic foot ulcer or lower extremity amputations increased 57% during COVID. It's really a silent epidemic, and much of that was due to access of care. So if we relax and change the licensure restrictions, at least the nurses do have the Compact Act. When it comes to advanced practice nurses and physicians, it's even more restrictive. So there is, there are acts that are before state legislature to enact a national license. I mean, we all have driver's licenses. We don't have to have a different license to cross state lines. And I know that there are nuances in scope of practice, but that's one really big thing. The other, from a legislative standpoint, is specifically, and Jamie talked about this, really hospital-at-home services. And, CMS has a current waiver for that because of COVID for hospital without walls or advanced care at home. That is really only in place through the public health emergency. There are acts before Congress now to extend that benefit and make that part a permanent part of CMS. I think that's really important. People want to be in their homes. There are studies which show that healing is better in the home, 70% less readmissions, Brigham's study. I mean, the data is there for care to be delivered, acute care to be delivered in the home with the right care teams.
Yeah, and I love that you brought up COVID because, of course, it's expanded the need, but also, facilitated and moved things along in ways that we hadn't predicted in terms of this adoption and the need. And so I'm wondering, to Tracy and to Jamie, some of the thoughts you have on how the pandemic really has impacted this transition to aging in place and technology, and have there really been some unintended benefits in some senses from the pandemic?
Well, definitely, in some of the work that I've done, we've seen some of the benefits. So, an AARP survey recently came out showing also a huge increase in older adults using video chat because of the pandemic. And so we actually developed this Zoom-based tele-Tai Chi intervention before the pandemic, but we're launching it during the pandemic. And so we had all of these training materials. We were assuming that all of our participants, not all of them, but a lot of them might not have had experience with Zoom. Well, sure enough, they almost all have had experience with Zoom, so that made our job a little easier. But I think that what's also we need to think bigger that, and I think Jamie touched on this earlier, having exposure to a technology and seeing that it provides a use in one domain will help people see that there's a use for that in another domain. So having people have all of this experience communicating with their friends and family via, tele kind of technologies, that we should, and I think are, harnessing that, taking advantage of that, and really getting people on board to services that are easier for them to access from home.
Absolutely, yeah. I'll add one of the unintended benefits or consequences, one or the other, is the spotlight that the pandemic put on healthcare's inefficiencies. Supply chain, for example, our staffing models, for example, and how in uncertain circumstances like a global pandemic, those will get disrupted. And so now a benefit of it is this focus on innovation, and healthcare systems and startups and incubators are infusing dollars and money into, okay, we have to innovate, we have to move quickly, we have to be able to respond to these unprecedented times. Who knows when the next pandemic is going to come? And we as a country have to be ready to take care of patients wherever they are.
Yeah, and I would add, I think it also shone light on some of the healthcare inequities that are inherent in the system and have been, but it sort of forced people to stop and see a lot of those challenges. And so, I just kind of moving on and thinking through that, I'm wondering, I know, Tracy, you had an article in 2015 about, envisioning this future for older adults. And I'm wondering, now, or even thinking about that article then, like, what are some of the future trends of aging in place technology?
Well, I touched a little bit on some of the robotics work that we've done in our groups at Tech, and also I think there's a presentation later. Dr. Charlie Kemp is a professor at Georgia Tech, and he is co-founder of a company called Hello Robot, and really robotics has so much potential for helping people, not only the healthcare providers, but also people themselves age in place. We also have a new NSF-funded institute called AI Caring, led by Sonia Chernova, and that focuses specifically on how can AI help people age in place. And so I think the next, 5+ years at Georgia Tech at least, we're really focusing on, there's a huge effort in how AI can help people age in place.
Jamie,
Well, we're really excited about the digital experience and all of the ancillary wraparound services that can now be digital. We're seeing a rise of labs at home, point-of-care diagnostics, ways to get medications to the home, and how we can bridge digital experiences to brick-and-mortar experiences in safe ways. Catalyst is really looking for those types of innovations, those partnerships. We're seeing consumers want it, consumers are using it, and now we have to figure out how to bridge that into your care team with your providers safely and in a very collaborative way.
Right, Joe?
Yeah, and I would add, when we talk about health inequities, really access to care is a huge inequity, and we know that in the rural populations especially. We know that there are rural hospital closings, but aging in place also means having access to health care where you live in the community if possible. I'll give you just another anecdotal story, but we had a consult recently on a wound patient in a rural facility in Alaska. And it was not kind of a life or death circumstance, but it was a person with a pretty serious pressure injury. And in order for that person not to, not for it to worsen, we came up with a care plan, implemented that care plan, and we got feedback after our e-consult that the rural hospital had intended to transport that patient by medevac 500 miles to the next level, higher level acuity care center. Now imagine the cost of that, the inefficiencies, as you said, it highlights it, but the cost to the patient from a physical standpoint. So it's those kind of things, and I think the pandemic has opened up a lot of options for rural health to improve with technology, create access to specialists that can help serve those communities.
Greg?
Yeah, just something that occurred to me as we discussed this is all the new technology advancements and innovation and the ability to deploy outside the traditional setting really opens up access to new data points, to new data. And data is the underpinning of all the, data and analytics is the underpinning of driving all the AI and all the workflow process improvement and things like that. So it's really important that we don't lose sight of the data side of the whole story here.
Yeah, I'll add, I think you called something out that's really important is the cost of this. I mean, aging in healthcare as you get older is expensive. And who's paying for this and who's putting on the burden? And that's another area that we as a community really need to put our heads together and innovate in how we're going to redesign these economic models. We know that healthcare right now is unsustainable in how we're paying for it. It's unaffordable for many communities, and that is a huge area that needs smart minds and work right now.
Yeah, I mean, there's so much to explore on this topic, and we could fill the panel with each of us talking about it for hours. And, I really enjoy this and want to continue that, but knowing kind of time is wrapping up shortly, I just wanted to sort of go through and ask, what we're most hopeful about related to the use of technology in healthcare and aging in place. And I don't know if you have any kind of final thoughts as well, if you want to add that in, and we could just kind of go through the line to bring that up. Tracy?
Sure. I'm really hopeful that technology has the potential to enable people to live where they want to live and do that in a way that's safe, that's comfortable, so that people don't have to be forced out of their homes. And but also just that they do get their needs, their basic and more than basic needs met at home. So I'm very hopeful that technology can do that.
Right.
I'm optimistic about especially the people in this room and the innovation that can happen and how we realized healthcare is behind, and now we have to be forward-thinking. We have to collaborate with non-traditional partners. We have to go out to the startup ecosystem and learn what they're doing, how they're designing experiences for patients, combine them with how we're designing experiences for clinicians to really improve care no matter what age you are.
Great. Yeah, I'm hopeful that a lot of the changes, kind of the structural changes that need to happen will happen with policy changes that we've talked about today. I've also, it makes me think, kind of being a long-time person in this space and how technology really has evolved with telehealth and remote patient monitoring and that kind of thing. But I've always heard healthcare is local, and I've always believed that you know, a lot of change that's tried to be implemented doesn't really take into consideration the local environments and communities and workers and all of that. What I'm hopeful about is I think healthcare will remain local, but there's a lot of opportunity to really connect with the outside world now and really get best practices and specialists available. And so I'm hopeful for that as well.
Yeah, and I might say, you know, my hope is in even this discussion and just the alignment of the different parties that focuses really on ultimately the patient and our communities, and that, you know, where we're thinking through the solutions, but we really have an aligned goal of making sure that they're set and solved. Greg, I don't know if you want to have any last parting comments?
Just real quick, I think that there's, as I fast approach that senior age, I think it's empowerment is a super important component to what we're talking about, and I'm very hopeful that there is a growing call to arms from people like me who don't want to give up, and from the care providers or the children of seniors that know that there's much more to life than being locked in a facility. So I'm very hopeful that we have the opportunity and that there's a push by all of you and others out there to really make this happen.
I think that's a great note to end on, and I thank the fellow panelists for their time, but really thanking everyone for listening and looking forward to continued conversations.